Hello and welcome to Health Dialogues. I'm Anshika Mishra, and today we're joined by Dr. Saurabh Mittal, Assistant Professor in the Department of Pulmonary Critical Care and Sleep Medicine at AIIMS New Delhi. Dr. Mittal is one of India's well-known lung specialists and has been closely studying the impact of air pollution, smoking and other risk factors on respiratory health. Every year, Delhi NCR struggles with dangerous levels of pollution, especially in winter, leading to a sharp rise in breathing problems. COPD cases too are increasing rapidly. Now, to understand what people should really know about this disease, we asked Dr. Mittal some key questions that every patient and family must be aware of. Now, Dr. Mittal, my first question to you is that pollution levels in Delhi NCR are rising sharply and are expected to worsen in winter. What precautions should COPD patients start taking right now? And how can they best protect themselves?
It is very important for patients who have lung disease such as COPD or bronchial asthma that they need to prepare themselves well for a winter season, specifically when the air quality is very poor. So the first thing we suggest is that you continue the medications your doctor has given you, whether you're inhalers or tablets, so that you do not get bad symptoms during winters and high air pollution settings. Secondly, if you have any problem, always seek a medical help. That means you see your doctor early so that you do not end up requiring oxygen or ventilator or ICU. Third thing is keep yourself indoors. That means if you don't need to go out for some work, try to stay in house, indoor. Keep your windows and doors closed so that you do not have a poor exposure to a poor air quality. If you have to move out, try to wear an N95 mask which protects you from the pollution which is there. Sometimes if you stay indoor, you can use an air purifier in a closed room so that your exposure to pollutants can decrease. So these are some ways a patient who has respiratory problems can save themselves from the effects of poor pollution.
Alright, doctor. Now my next question to you is, how serious is COPD as a disease? How should people understand its actual severity?
So COPD is a very serious condition. So if you look at the global data, COPD is third or fourth leading cause of death around the world. The major cause of COPD in other areas of the world are probably smoking. But in India, we see a lot of non-smoking COPD, which can happen in patients who are exposed to high pollution or ladies who cook on the biomass chulhas. So those are the individuals who develop COPD in Indian settings specifically.
Okay, doctor, moving to the next question. How can someone recognize that they may have COPD? Like, what are the early symptoms people should watch out for?
So any patient who has cough, shortness of breath and sputum production on a regular basis, somebody who has coughed for 2-3 months, they are producing sputum and it probably happens every year for some time. So those are the patients whom we think that they have COPD. COPD generally happens after the age of 35 to 40 years of age, or somebody who has been exposed to whether it is pollution, whether it is smoke or whether it is the biomass fuel exposure. If you have some exposure, you have the symptoms, you think of COPD and see a doctor whether I may have COPD.
Doctor, my next question is, when should a person consult a doctor for breathing problems? Like, which warning signs indicate that COPD may be getting worse or becoming serious?
So whenever you have symptoms which are going beyond 4 or 5 days, you should see a doctor for an initial checkup. Why we suggested that if you have a problem which is early, we can prevent the progression of the disease so that it doesn't get bad. Supposedly you smoke, you have problems, you come to me, I tell you stop smoking. You stop smoking, you will be fine. So if you have some occupational exposures at your workplace, you can stop that and you'll be fine. So early picking up the problem will definitely help in your long-term benefit from the disease.
Alright, doctor, my next question to you is COPD preventable? What are the practical steps people can take to reduce their risk of developing it?
So preventions are first that we have to reduce the exposure. If you smoke, do not smoke. If you work in a factory or in areas where you are exposed to chemicals which go into your lung, try to change the setting or wear a protective mask. Like there are occupational masks which are available for people who work in such sites, that they can wear them so that their lungs do not get the dust or the particles which are there in the environment. Also, government also had the Ujjwala Yojana where...
Doctor, Delhi's pollution is severely affecting children too. So how does polluted air weakens the children's immunity and what can parents do to protect them?
So ये तो बहुत मुश्किल सवाल है, बट ये देखा गया है कि जो लोग पॉल्यूशन के एक्सपोज होते हैं उनको बार बार लंग के इन्फेक्शंस होने के चांसेस बढ़ जाते हैं, तो डेफिनेटली इम्यूनिटी को कम करता है और बॉडी को इन्फेक्शंस के लिए प्रोन बनाता है. सबसे बेस्ट है कि इंडोर रखें। जब हाई पॉल्यूशन एरियाज हैं, बच्चों को बोले घर में ही रहे, घर में ही खेलें, मिनिमम टाइम के लिए बाहर जाएं। अगर खेलना है तो ऐसा एरिया दे जो कि कवर्ड हो, ताकि जहाँ पर हवा का सर्कुलेशन ना हो, क्लोज एरियाज में बच्चों को रखेंगे तो आप उनका एक्सपोजर मिनिमम कर पाएंगे।
Doctor, along with children, newborns are the most vulnerable in the polluted air. What precautions should parents take to protect newborn babies from smog and poor air quality?
They have to be kept inside the doors. Obviously, they have to breastfeed. That means अगर वो breastfeeding करे, breastfeeding से immunity improve होती है. So they have to be given a precaution which generally their mothers take. So if they have to indoor, the mother stays indoor. That will be fine for them.
Alright, doctor, my next question to you is, how does air pollution impact the heart? And is it true that pollution can trigger or worsen heart disease?
So pollution leads to heart disease in long term. Supposedly, who does not have somebody who was supposed to have a heart disease at 50, if they are in high pollution environment, it can happen at the age of 40. So air pollution leads to acceleration of heart disease. It comes early and it gets bad when it is in.
Also, doctor, apart from lung and heart issues, which other diseases or health problems tend to worsen due to high pollution levels?
So this can lead to brain stroke, memory problems, fatigue, tiredness. Those are very common symptoms in patients who are exposed to high pollution.
Thank you, Dr. Mittal, for sharing your expert advice on COPD and how one can protect themselves and their families during this air pollution. Thank you so much for sharing your valuable insights. Thank you once again. Thank you for watching.